United States and the Canadian healthcare. What is healthcare and how do we supply it? Next slide. What is the definition of healthcare? Well, the definition of healthcare is the improved health and the means of preventing, diagnosing, and treating diseases, illnesses, injuries, and cancers, and other related issues that impairs the mental and physical state of a person or persons. Next slide. What is a healthcare system? A healthcare system is an organization of people, institution, and resources that would deliver resources that will guide and deliver healthcare services. The system will target the health and the population of which that healthcare system lives in. Next slide. Canada is a one government-run healthcare system, which means that Canada only supplies one type of issued healthcare system to every person in their population. There are no other choices on which health care system they will get to choose from. They are mandated to use just this one. The healthcare system in Canada is funded by the Ministry of Health, which means all of their money that the medical community receives comes from this ministry, which means they're based on a fixed cost budget that only allows them a certain amount of money for the services that they provide to their people in Canada. Next slide. Canada does not allow private insurance companies. It is totally and completely against the law, and you can't go looking for any type of private insurance if the one government issued insurance does not cater or cover the type of treatment that you need for your illness or disease or the cancer that you might be going through. Another thing that Canada issues is that they don't reimburse the participants that they supply insurance to, which means, for example, let's say you go to the eye doctor and you pay the bill, you can't submit it to the insurance company to get reimbursed for the amount of money that you paid to visit the doctor that day. Canada is slowly becoming a medically needed country, which means that preventative medicine is dwindling out because of the fixed cost budgets that they receive. They can't afford to see you for, let's say, a physical, to maintain good health. They just basically want to see the individuals who really need it. They're getting waiting lists for these individuals as well because due to the budgets, they can only see a certain amount of patients at a time. So they've created long waiting lists, which means you can wait months to actually see a physician. Physicians and hospitals are now on fixed budgets, and the medical treatments they provide at the facility are only based on how much money they receive monthly. Next slide. The United States is the country that spends the most money for their healthcare system compared to any other country in the world. They receive their funding from, let's say, public payers, private insurers, and our individual payments that we pay out of our pocket from our paychecks monthly. Employers can voluntarily issue medical insurance to their employees, meaning that they would pay a portion of the premium while the employer pays the other portion of the premium. But the employer does not have to supply private insurance, which means that the employer can go on what now we call Obama Healthcare, and they can go on the website and find a private insurance that they can afford to pay monthly. The United States does help the elderly and disabled with medical insurance because they were taxpayers through their working years. So now to reward them, they supply them with insurance. And individuals who don't have insurance can still actually go see the doctor, but they need to go to places that will allow them, like clinics that will provide a payment for non-insured persons, or the health department, or they can even go to the hospital emergency rooms because the hospital emergency rooms cannot turn away a patient. Next slide. The United States health system allows our health community to work wherever they choose. So a physician can practice in any state, any city that they choose in, and hospital organizations could build hospitals in any state or city that they also chose to do so. What's really awesome about our healthcare system is that a physician who's treating a patient and they have a very bad illness that needing to be admitted into an acute care facility, like such as a hospital, the hospital will allow that physician to enter and maintain treatment on that patient as while they are under the care of the acute care facility. There are also private nonprofit organizations that make money within their company, and then they recycle it back into their company for their means of money to fund it. But there's also a private for-profit hospitals or organizations who receive money from both within their company and they get the aid from the government. Next slide. There are several types of insurance that the United States offers, like private insurance, which is majority of the population in the United States. Usually these are paid from monthly paychecks or out-of-pocket expenses. So that way they will have medical insurance that needs to cover them while they are in their working years. But once they exit their working years, they can get a type of insurance called Medicare, which is offered to our elderly and disabled as long as they are over the age of 65 for the elderly. And this provides them with either Medicare Part A or Part B, which will cover like acute care facilities, some nursing homes, eye visits. But the only problem is that Medicare does not offer prescription coverage. So recently, Medicare has let out a prescription plan that elderly can actually pay monthly to help cover the high costs of their medications that they need. The U.S. also offers a health insurance to the poor, but they have to actually qualify for it, which means their income is too low or at a certain level, and they have like hardly any assets, and this is called Medicaid. But Medicaid is also offered to mothers who are pregnant. So if they don't have insurance, they'll be covered throughout their entire pregnancy, and then once the infant is born, then they're covered for a certain period of time for both mommy and baby after the delivery. Next slide. There are many comparisons between the United States and Canada. The biggest and most obvious comparison is that both countries offer some type of medical insurance to their people. The healthcare organizations of both countries are a fee-for-service system, which means once you get the service, you got to pay for the service. Somebody has to pay for the service, whether it be the person, an organization, an outside source. The service must be paid. Both countries have wait times, whether it be a waiting list on, the month you're going to receive the treatment or see the doctor, or how long you actually wait in the doctor's office to see the doctor, or the actual emergency room wait times. There are definitely wait times in both countries. There's rules that the insurance companies have to put out there for physicians to follow, which means like you can't just schedule yourself for a total knee replacement. The physician has to actually document that they did, MRIs, they did imaging, they did rehab, they did injections, they did all they could do possible before they actually scheduled that surgery. Next slide. The elderly, they have found out in both countries that they're staying in acute care facilities longer than they need to, which means it's taking money out of the budget. And organizations have to, discharge patients in order for new patients to come in order to make more money. So they have to pretty much care for the patient, get the patient better, and then send them on their way. There are definitely restrictions for the coverage, whether it be a payment source or a deemed medically necessary to proceed with the next action of care. So basically what that means is that in order for you to receive the care, you have to make the payment, like I have already said in the previous slide. There is also educational items in both countries, whether they be seminars, pamphlets, whatever they need, whatever kind of education that patient needs to understand their condition, the treatments that are associated with that condition, and where to receive that treatment. So as you can see, both countries have their, type of medical care system or healthcare system that they feel is best for their population and how they can actually afford it. They're paid different ways. They're distributed in different ways. But the moral of it is that they both supply some type of coverage to help their people when it comes to them being ill. So with that said, hope everybody has a great night.